So this is the 24K fat grafting, which I've been using since 2017. And I use it on every single face neck lift I do, or 95% of cases. The next step is to get the Adinizers ready. So these are our Adinizers. I go 2400 to 1200, down to 600. And then the next stage, what I'm gonna do is I'm just gonna infiltrate some local anesthetic into the abdomen, because that's where we're gonna take the fat from. So that's what I'll be doing now. So then I'm just gonna introduce the 24K syringe device, and then while it's in, I'm just gonna draw back, and you should be able to hear it click. And that will provide negative pressure. And then just basically a to and fro motion, you can start seeing the fat coming into the syringe. And you can see the way of doing this with lots of local. You're pretty much just harvesting fat. There's not a lot of blood in there, which is great. Okay, so you can see that's 50 harvested. And I'm just gonna do the same with the other two. So you can see now we've got 3 syringes full. This is the first one we've taken. So you can see it's already kind of separating on its own into fluid and fat. And now we're gonna put these 3 syringes in the centrifuge, and that will just expedite that separation. Lovely. And then that's all done now, and you can see we've got blood, fat, which is really good fat, and then oil on the top on all of them, which you can see there. So first thing I'll do is I just pour the oil out, okay? And then what I'll do is I'll unscrew this, and that's all blood in there. Take all that blood out, and you can see what we're gonna be left with is just injectable fat in there. And you can see it's pretty much a closed system, which is pretty clean so far. There's hardly any mess. Often when you do fat grafting, it's a bit messy. And there's no handling by me of the fat. It's all done in the device. So you can see we're all done now. And from a processing point of view, we've got 10, 20, 30, 40, 50 mils of fat from taking out about 150. So we lose a third of it with the centrifuge and getting rid of all the oil and also the liquid. And you can see there's our fat. And it's relatively thick, but we can probably get down to the same thickness in any case with the Adinizer. So these are our Adinizers here. And then I'm just gonna basically pass it through. And my endpoint's actually until I think the thickness is right. I don't have a position of how many times to do it. Like sometimes when it's thick, you've got to do it up to 5 times. But my endpoint is actually just looking at the fat to see what it looks like. And you can see already, as I've been passing it through all the Adinizers, you can see already now that that is liquid compared to this, which hasn't been processed yet. And so this is great and ready for the face. So now what I'm gonna do is I'm just gonna transfer the fat to injectable 1 ml syringes, because this is how we're gonna inject the fat in the face. We're gonna make a small hole with a needle. And you can see this is just an 18 gauge needle. So the fat will actually go through an 18 gauge needle. That's how thin it is. So it's essentially like you're injecting filler, but it's filler of your own fat and stem cells. And then we just use these fine tulip cannulas to inject the fat. So you can see how thin they are, and the fat will go through that. And you can't do that without the Adinizer.